Okay guys, family systems, walls changing gender norms, chapter 12, transitional dilemmas. Gender is a fundamental organizing principle of people's lives, relationships, and society. Gender is typically understood to be biological assignment to derive from one's biological sex, and how we socialize our children to become feminine, masculine, male, female, assertive, submissive, passive, aggressive, and what those things mean. Gender is intertwined with other dimensions of social expectation and power: race, social class, sexual orientation, faith systems. All of those things impact the emotionality of how we feel our gender issues, particularly with our children and within our family and couple dynamics, is constructed, whether there is gender equality, gender inequality, and how those differences are exaggerated or incorporated. Families are organized by gender at the societal level. Who earns the money? Who goes out and works? Who has power? What are our normal family processes? What happens when we have same-sex families? What is the level of equality or inequality within intimate relationships? What are the assumptions about what a person's needs and desires are? Who gets priority? How our relationships are structured according to power differentials. Looking at the work of McWhorter, Sanders, and Reinisch, the relationships of same-sex couples are characterized much more by egalitarianism than heterosexual relationships. Again, some of that based within not only social constructs but faith system constructs. Consequences of gender-based family life. Parenting is influenced by gender. Who is the caretaker? Who takes care of children? What kind of toys do little girls get? Do little boys get? How are domestic disputes resolved between genders? What belongs to this partner versus what belongs to that partner, and how those things socialized and changed across generations. The family of origin issues, Bohemian treatment, genograms, looking at family themes and patterns, how gender norms influence children negatively or positively. An increasing number of females in American families suffer from depression, eating disorder, addictions, suicide attempts, possibly because of rigid gender expectations. Sometimes domestic violence, family violence, or more so, aggressive behaviors are more so seen within male children. No more than 2% in 1976 of partners felt that women and men should have equal power in relationships. While that has probably on the uprise and changed considerably based on career opportunities and income, some of those things still remain in place. Looking at barriers to equality in families, what the ideology is, what the culture, race, class mentality may be, what family responsibilities or ideologies may be that are detrimental or positive impacts on family life. Looking at rules and how we socially construct our understanding through popular media, through television programs, through songs, through social media, how we structure it based on the economic system, going back to what we discussed in earlier chapters about glass ceilings, that other cultures and female gender may do the same jobs without receiving the same pay scale. The ideologies we have about feminism and motherhood. Is it okay for the absentee parent or the abandoning parent to be male? Is that understood to be a social construct we can live with, where if the abandoning parent were the mother, is that considered to be much more socially detrimental? And why do we feel those ways? Do we give more credence to single parents run by mothers versus single parents run by fathers? What do we think about mothers who put 6-week-old babies in daycare? What do we think about families who have fathers that are the stay-at-home dads? even though we don't always talk about these things directly, all of those things are just under the surface. And those values and prejudices and discriminatory belief systems are there, both from the clinical side with us as well as within our families. And having honest conversations to draw those things out. Do we have families that use gender as a justification for inequalities in family life? Do they reject gender as a justification for inequality? How is the feminism movement, which those things with Claudia Black and other therapists who have addressed that, McGoldrick, Silverstein, very directly, has that changed? Is that still needful? It's kind of like the question about racism. Is racism dead or is it alive and well in America? Is gender equality and still aware? To have a gender-aware therapy practice, looking at the work of MFT in 2000, Zimmerman and Haddock, the Power Equity Guide, which is in your appendix in your book, 12.1, to be able to hold discussions like this with your families. If you look at that particular addendum, let's see where it may be in your book, and I would certainly like to see some of those things incorporated in the work that we do as we go forward. So, be able to hold honest discussions. The appendix 12.1 is on page 328. It's a feminist informed family therapy model that has a discussion at the beginning on how to open this discussion, how to summarize it, how to evaluate, form treatment planning, how to use it in training for your counselors, in therapy, for supervision, and for research. A lot of good information there. There is goal setting for relationship characteristics, work, life goals, activities, communication, conflict resolution, decision making, housework, finances, sex, abuse and violence, separation and divorce, for both male and female clients and for children. So I would encourage you to look at that, finishing up through page 336 as you look at your work. Thanks again. We'll see you soon.